Hi everybody, welcome to week 10. The title of my final is Healthcare Vocations, an application of Tim Keller and Douglas Sherman for Christians in the care services industry. Those are the two authors I'm reading from my paper, and the main question I'll be seeking to answer is how do we best practically integrate our faith while working in the care services industry? Now, the reason I use the term care services rather than healthcare is I think there's a connotation with the term healthcare that points more to doctors and nurses in a formal setting, and that's not really my context. I have two part-time jobs while I'm at Fuller. I'm a vision therapist, and the other one is I provide in-home supportive services for the disabled. Before I talk about the books, I want to give a little bit of background about how I got into this field, as I think it provides a good understanding for the lens I use to view it. You probably noticed that my speech is a little bit off. 10 years ago, I was in a severe auto accident and I was in a coma for 2 weeks. When I came out of the coma, I was 40 pounds lighter than I am now, and I was assigned a bunch of multiple therapy programs for rehabilitation, occupational therapy, speech therapy, physical therapy. The only problem is none of these offered any treatment for the extreme double vision I had that kept me from driving. But simply by God's providence, I happened to hear about a new field called vision therapy. And after a few months of vision therapy, I no longer need an eye patch and was able to get my license back. But the hospital recommended that I wait 1 year to recover fully before trying to work. Now, 4 months shy of that 1 year mark, my wife became pregnant with our first child. So I thought, I got to get a job. So I prayed, all right, God, I'm supposed to wait 1 year, but I'm sure I can bag groceries or do something. But you know what I'm capable of more than I do. So whatever you want me to do, I want to do. Please lead me. I didn't say anything to anybody yet or even start a job search, but within 1 week, my vision therapist came to me and said, hey, we're hiring an assistant, and you know the exercises by doing them, why don't you apply? Well, that was 9 years ago, and I'm the senior therapist there now. So with those circumstances, it's easy to see why I'm able to look at things from their perspective and honestly sympathize with how they feel. But if you look into it, me being positioned in something I had to overcome is not that unique. Oftentimes, counselors at drug rehabilitation centers used to be drug addicts themselves, or people who work in prison ministry used to be in prison. It seems pretty common as a means of restoration with God that He takes your struggle and turns it into your strength, or transforms your mess into your ministry. From the patient's perspective, it's helpful because you're able to offer advice that only someone that was in their situation would fully understand. And from your perspective, it helps because when it's easy to relate, it's easier to love. And if we love one another, God abides in us. 1 John 4. Now, both authors agree that approaching these matters with love is key. Keller writes that competent work is a form of love. And Sherman notes, the norm of love should govern Christian action and character in each and every calling. Now, I just turned in the reflection today, so I haven't finished Sherman's book, but it seems that they define calling and vocation differently. So this is where I ask you to comment on how you define vocation. Sherman explains, the doctrine of vocation is not concerned with how to make choices between this and that career path, but is more about how to relate Christian faith to the totality of one's life. But Keller seems to use a more narrow definition to identify it to specifically mean work or employment. He writes, the source of the idea of work as vocation is the Christian scriptures. So I guess my question is, even though proper ethics are applied to both definitions, how do you view vocation? Is it in a broad sense of all of life, or is it more in terms of employment, and why? And now thank you for your time. Good luck.